got your friends, you got your money, got your family, got your honey. You think you got a million days, but then life comes along and it knocks you right down to the ground. And that's why I say that everybody ought to hug somebody at least once a day. And everybody ought to kiss somebody at least once a day. Everybody's gonna miss somebody at least once a day.
Please welcome to the stage Holly Kuzmich, Executive Director, George W. Bush Institute, and our esteemed panel.
Well, good afternoon. It has been a great day of programming here, and I'm delighted to be here with this amazing group of leaders who all just happen to be women as well, to talk about an important issue, which is how health and economic development and growth are linked for women around the world, and the work that these panelists are doing to tackle those issues. And so I'm really delighted to be joined by Kathleen McLaughlin, who's the Chief Sustainability Officer for Walmart, Ambassador Debbie Birx, who's the Ambassador at Large and U.S. Global AIDS Coordinator, who runs the President's Emergency Plan for AIDS Relief, Lydia Musonda, who is a cervical cancer survivor. She's a mother of two and an entrepreneur from Zambia, and Gunilla Carlson, who's the Acting Executive Director of UNAIDS. Thank you all for being here today. Kathleen, I want to start with you. You have worked on women's economic development issues at Walmart. I want you to talk about why you work on that issue and why Walmart made that decision to invest in women and economic empowerment.
Yeah. Well, for Walmart, as a retailer, a huge portion of our customer base, in fact, the majority of our customers, are women. And often in families, it's women who are making the purchasing decisions. So having a healthy, vibrant customer base obviously is important as a retailer. And then there's also the supply chain. So much of our food, the other products that we sell, come from supply chains where either women are entrepreneurs or they're working in those supply chains. And so we've got quite a large program in our sourcing to help improve the farming, factories and so on, conditions in those operations and help the women that are working in those. And we've done some really interesting interventions where, for example, in factories, we developed a program to train women working in the cut and sew factories in India, in Bangladesh, in China, in different countries in Latin America, and so on. And what we found was that combining health interventions with interventions that grow the confidence of women, as well as help them with the technical aspects of their job. When we combined those things in training programs, it actually generated significant benefits for the women and their own families, as well as help the factories succeed. And that was really what we had set out to do. We wanted to show that there could be a shared value proposition, meaning it would be a business case as well as a case for the women and for economic development and for health. To do that. And so we find that pretty exciting. A number of other companies have been experimenting with similar programs, people like Gap and so on. And we worked with a number of organizations to do this, CARE, BSR, and so on, Swasti in India. So what we're hoping we can do is actually make this the norm for women working in factories and apparel. Similarly, in agriculture, we've been doing quite a bit of work sourcing from smallholder farmers in places like Mexico or India for our local retail, but ideally over time even for export to grow those economies. And many of the farmers are women. So again, we've been trying to find interventions that would help the women and their families as well as improve the sustainability and the productivity of the crops. So for example, in India, one of the projects we've been doing for the last couple of years has been with Tanager. And this is actually a project that we have been doing through the Walmart Foundation. So the women were growing peanuts as a cash crop. Not only have we been helping them improve the productivity and sustainability of that production, but we've introduced millet counterintuitively, because that's a very basic crop. But that's actually quite helped with the nutrition for those communities, and the women are now looking at value-added forms of millet, so turning it into bread and so on, to actually increase their incomes as well. So it's actually having a positive benefit on the nutrition of the women as well as the economics of the agricultural sector. So I think an interesting question is, to what extent could we embed health interventions in supply chains of the consumer sector, whether it's retailers or product companies and so on. And that's just one example of how we can have an intersection between what's good for communities, what's good for health, and what can grow the economy locally.
And can you talk a little bit about this research you were mentioning that you all have been doing on this work to make sure you're seeing the effects you want to see?
Well, so as we were completing the program, the Women in Factories program, we engaged Tufts to do a randomized controlled trial around the program itself to see, can we prove out that we do have this shared value benefit, that there are business benefits as well as benefits for the women. So they ran a study, it's published on our website, and it showed that yes, actually there were substantial benefits on both sides of the equation. And for the women in terms of health, it was things like the hygiene training, use of sanitary napkins, the nutrition training, eating breakfast in the morning, and very specific impacts that it had on those women and their children. Breastfeeding, reproductive health, and so on. And this was all training that was being done in the factory, sanctioned by the factory manager on the case that, look, if you let us do this, along with, yes, we'll also train them about business and so on. If we do this together, you're gonna see a big improvement for your factory. And what the study showed is much better retention, much better on-time attendance, much better productivity. So we had this dual benefit. And that's why we're excited about it. We think there's a case to make to businesses that sustainability, in this case social sustainability, is not a trade-off for business. Mm-hmm. It's not a cost consideration. It's actually going to help improve the value of what you're doing. So that's just one example, and we don't have time to talk about a lot of others, but I think there are a number of ways that private sector can be almost a delivery mechanism for health interventions. Sort of like Intel Inside. Slip it inside and just do it as part of business, and it can have a big positive impact.
Well, and of course, we too often think of health and economic growth as two separate issues, but they're of course linked.
Of course.
We too often don't think about them.
Healthy, happy people are going to be much better employees and much better customers, and it's all synergistic. You can't have economic health without social health and environmental health and health. Those things need to all be solved simultaneously.
Yep. Ambassador Birx, you obviously have a big job in running PEPFAR, and we've made tremendous progress in tackling HIV/AIDS around the world. Talk about where we are on that, and then talk about the work you've done to really reach more women and girls and why that's been the case in terms of your core mandate at PEPFAR.
Well, great, and it's good to see everyone out there. I think what's been exciting about PEPFAR from the beginning is because we were starting really from ground zero. No one was on treatment in sub-Saharan Africa and many resource-limited settings. We were given permission to take risk, and we were given permission to take high risk. But on the flip side, we had to have very strong data systems to really prove whether we were having an impact or not. And I think many people understand that PEPFAR grew out of prevention of mother-child transmission, really saving the children and then realizing that the children needed a mother in order to grow up healthy and strong. And so PEPFAR was, from the beginning, a comprehensive health approach to an issue that was actually decimating many communities and therefore countries where a third of the adults were infected. And so taking that risk-taking, because we have bipartisan support to really be on that forward-fronted envelope, we were able to do just what she just described in the opposite, realizing that for young women, which is, we started a program called DREAMS, Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe Young Women, realizing they had to have all of that in order to grow up healthy and thriving. And so we brought non-health programs to the world of women and young girls in communities to sustain them and create a healthy environment and really keeping them AIDS-free. And their voices have risen up, and they've truly become leaders of democracy and governance, and countries have been really moving forward with vibrant women. So we ventured into the non-health space, why companies are venturing into the health space. And I think bringing together corporations, which has been critical for our success with young women. which really grew out of a Concordia discussion, and bringing those corporate entities that really knew how to message to young women in a way that young women heard our public health messages, because our messages are kind of boring. And so we've really been able to dramatically decline incidence in young women. But I think constantly pushing for smart integration and understanding the lives of women and being able to move forward not only with prevention, but also more comprehensive treatment. And so that's why we've moved into so much cervical cancer.
Well, and let's talk about that quickly before we get to Lydia. So the Bush Institute, PEPFAR, UNAIDS, and Merck have a partnership to address cervical cancer as an outgrowth of the work we do on HIV/AIDS, because women who are HIV positive are 4 to 5 times more likely to get cervical cancer. Talk a little bit about that work and the results we've had over the past year together.
The exciting thing about using data is it allowed us, just as like we talked about, what we've been able to be successful is because we've been able to double the number of people on treatment in a flat budget, and we did that using business principles. In doing that, we were able to see through data that women in their 20s and 30s that were HIV positive had a much higher risk of cervical cancer, far greater than the HIV negative women in the communities. And so we were able to move the program with the Bush Institute and UNAIDS to a focused program addressing the women most at risk, just like we do with our Vulnerable Dreams program, really targeting the resources to the community that needs them the most, and really much more on an equity approach. And we've been able now to really screen large numbers of women in real critical places. But I think what the Bush Institute brought is a real political willingness to work with high political leaders, because the stigma of cancer in many developing countries is the same as the stigma around HIV/AIDS.
Right.
People wouldn't talk about it, people wouldn't deal with it, people didn't want to go to the clinics. And I think understanding that and getting that high-level political will, the Bush Institute has brought the political will. Merck is bringing primary prevention, and we're doing secondary and primary prevention with those skill sets brought together. And so we're really seeing, and that's why we need entrepreneurial opportunities for young women, because we're going to have healthy, fabulous, AIDS-controlled, cervical cancer-controlled communities, and they need jobs. And you all have those, so hopefully you'll bring those jobs to us next, specifically for young women.
Okay, Lydia, thank you for being here. Please share your story about being a cervical cancer survivor with this crowd and what you've gone through.
Okay. My name is Lydia Msonda. I'm 29 years old. I'm from Zambia. Whew. My story goes like this. I just started feeling weird, whereby I started seeing blood coming out. I didn't know what was happening. I was bleeding a lot, and the bleeding was very smelly, the blood, I mean. So I didn't know what was going on with my life. So a friend of mine who learned about cervical cancer from school, she came to me. When I explained the problem that I was facing, she came to me. She asked me if I've heard about cervical cancer. I had no idea about it. That was my first time. She encouraged me to go to the clinic to do the screening. After I went to the clinic, I did the screening for cervical cancer. The doctor told me to do the biopsy, which I did. I took the sample to the lab. After 2 weeks, the results came out. I was asked to do the CT scan. After doing the CT scan, I was given a report saying I had cervical cancer, which has gone up to the left ovary. And I was told to start the treatment of chemotherapy, radiation, and brachytherapy. The time the doctor told me that I have to do all this, I didn't know what to do. Looking at my family background, I'm the firstborn in the family. My mother is a widow, and I'm a mother of 2. who is single, no support. I'm the one who's supporting my family. I do everything for my family. And I was discovered that I have cancer. What came into my mind was, I'm going to die. What happens if I die? Who's going to look after my family, especially my children who doesn't have a father? And to make matters worse, my mother has hypertension. I was devastated. I was heartbroken. I didn't know what to do. But I just said to myself, there's nothing that I can do. Since I've been discovered that I have cancer, what else can I do? I just have to start the treatment. I started the treatment of chemotherapy. Of course, it wasn't easy. I passed through a lot, looking at the business that I do. People look up to me, my family, and the workers that I have. It was
And Lydia, how's your health now?
anyway. I had no option but to start the treatment. The treatment for cervical, before I started the treatment, I went through counseling, which they told me that when I do chemotherapy radiation, I won't be able to have children. Looking at my age, I'm still young. I also need to get married one day. What happens if I get married and I can't conceive? But I had no option. I have to live for my family, for my children, and for these other workers. They also depend on me. They have also family, and they look up to me. So if I died today, what happens to them? I went through all that. I started my treatment. I lost my hair, but as of now, you can see. I wasn't like this. I wasn't like this. It was very difficult for me, especially whereby my family depended on me, as I said earlier on. My family depended on me. I just had to beat this, and I said to myself, no matter what, I have to beat this. I have to beat this cancer. I went through all the process, not until I finished the treatment. After that, I went back to for reviews, and I was told, I'm fine, I'm cancer-free. The things that I couldn't do the time I was sick, because cancer is something painful. It's something very, very painful. I couldn't sit like the way I'm sitting for a long time. I have to take maybe 3 times painkillers. The smell, we can't sit like the way I'm sitting with you here. I can't sit with people. I used to have a self-stigma. I was isolated from my friends, especially that when moving in the public transports, how can I sit with people like this? I'm smelling, they won't feel comfortable. So it was something, it wasn't easy for me. But after the treatment, everything went back to normal. I can do what I never used to do. I can do my business, but my business, it went down because I couldn't do the marketing that I used to do. I couldn't sell. But as at now, at least I'm trying. I'm grateful, especially to God and for the treatment that I got from UTH.
Well, thank you for your courage in sharing your story and helping to push back on that stigma and really be a face for why it is we do this work and for doing what you do. So thank you for being here, Lydia.
Thank you.
Gunilla, tell us how UNAIDS is involved in this and why they're involved in an issue like cervical cancer. It's pretty easy to see after you meet Lydia.
Yes, and I think also we owe you a great thanks for being able to tell about this and to shed a light on the stigma and discrimination that we might see from cancer, but equally also from HIV/AIDS. And if we don't have this holistic approach and also realizing that many people living with HIV are more vulnerable to cervical cancer, and many people, as we are partnering so well with PEPFAR, we know that we go to the poorest countries, to the poorest situations, where also poverty in itself and inequity is one of these things that we have to tackle and to understand how we better can serve the communities, also addressing not only HIV, but also cervical cancer, because it's the same thing. Mm-hmm. It is about screening. It is about, of course, also here with cervical cancer, there is a vaccine, but also access to treatment. And the thing that we also can see now, how we have to address this together, and we are so happy for this partnership with you and also with PEPFAR and the Bush Institute and Merck, because it also gives us a lot of knowledge, and it gives us the reason to continue to fight and to see that we can't just treat HIV in isolation, and to see the full family as well, because behind you there is a full family, there is a community, and that's why we can also learn so much from the communities themselves, but equally in these partnerships. So it is really a good opportunity to come here and to thank you for that and giving us the space as well as a UN entity where we have to do more, but we can only manage this if we do it together.
Yeah.
Well, Lydia, you are a great example to show how health and economic development are linked, right? Not only are you providing for your family, but your staff as an entrepreneur and the people around you in your community. So we're so grateful you're here today, and thank you to my panel today for really making that point of the connection between a healthy woman and a healthy economy. Thank you all.
Thank you.
Thank you.